As previously mentioned, today we'll be talking a little bit about meningitis. However, we'll be emphasizing on how our immune system might fail or accept the virus or bacteria within our body. But first of all, we have to know what meningitis is. Meningitis is an infection or swelling, also known as inflammation, of the fluid and membranes that are around the brain and our spinal cord. And these membranes are called meninges. So, there are 5 different types of meningitis. The most common one is the virus. However, it's not that serious, and there's a vaccine that exists to prevent meningitis. A virus meningitis. We have the parasites, which are rare, the fungi, which is as well not as common, and it just will affect the people with immune system. However, the virus and bacteria could affect between any age ranges. However, the bacteria is a life-threatening. It requires immediate treatment, and an example of the bacteria includes a Haemophilus influenza type B or HIV. We also have the non-infectious causes, which can be due to a chemical irritation, drug allergies, certain cancers, and inflammatory diseases. And stress can also trigger meningitis because our immune system can be lower due to stress. And excess of weakened immune system, as previously mentioned, or increased substance use can cause stress or our immune system overall to decrease. On the trifold I previously handed in, you can find deeper information from symptoms to how to prevent meningitis itself. So, as we mentioned, can the immune system fail or accept the bacteria within our body? Well, first, the bacteria itself will invade the mucosal surfaces, which include our throat and nose. It's all the mucus in those areas, also known as the nasopharynx. However, there are antibodies and immune cells that will constantly check on these parts. If the bacterial load is high or our immunity is weakened, the cells are able to multiply and later enter our bloodstream. There are certain physical barriers that can cause the meningitis bacteria to be spread quicker among our body. This includes head trauma, which is a direct path for a bacteria to enter our meninges, a neurosurgery, which since it's our brain open, it can introduce any bacteria, the medical devices, which is a route to infection, and ear infection, which directly extends to the meninges. We have the bacteremia, which is the initial colonization site of the meningitis bacteria that manages to cross our mucosal barrier and enter our bloodstream itself. Then, our immune system in the blood, which are the macrophages, will work to clear the bacteria. Although the majority of the meningitis bacteria can evade these defenses. They evade them by capsules, which are polysaccharide capsules that surround the meningitis bacteria, which help the bacteria itself to not be recognized and killed by the good bacteria and make harder for phagocytes to engulf the bacteria. Next, we have factor H binding, which is when the meningitis bacteria makes a protein that will grab to our body's factor H security guard, which disguises the bacteria as our own cell, so our immune system will not attack the meningitis bacteria, allowing the infection to be spread. We have the temperature sensing, which is when the bacteria can sense the high temperature and increase the production of capsules, which it will make harder for the immune system to target. And lastly, we have cell wall modification, which is when the bacteria can modify their cell wall components to resist the peptides created by our host immune system. Once in the bloodstream, our bacteria must cross the blood-brain barrier, or the BBB, to reach the meninges. The BBB is the interface that will protect our brain from harmful substances. There are multiple methods that our bacteria can reach BBB, and this include the paracellular route, which disrupts the tight junction between the cells that make up BBB, and the bacteria will squeeze through it. It is easier for the meningitis bacteria product and the inflammatory response to occur. Next, we have the transcellular route, which crosses directly the cell of the BBB. They can adhere to them and be transported across the cell. We have the Trojan horse mechanism, which is when the meningitis bacteria can infect immune cells like monocytes and macrophages in the blood that can easily cross the BBB. And lastly, vulnerable sites, where bacteria itself can go through the cerebrospinal fluid at sites where BBB is more permeable. The bacteria is in the subarachnoid space, which is between the arachnoid and pia mater, or where the cerebrospinal fluid circulates. They will multiply and trigger the inflammatory response from the brain's immune cells. However, what is this inflammation or inflammatory response? Well, it is what we know as swelling or edema, which is the fluid that accumulates and puts pressure on our brain. They increase intracranial pressures that can damage brain tissue and restrict blood flow, and the cerebral vasculitis, which is the inflammation in our blood vessels in the brain, reducing blood supply. These are all main reasons or effects that meningitis has on our brain that can become that can make bacteria meningitis so dangerous. From my dad's point of view, he had suffered from 2 meningitis already. It was a bacterial meningitis. They said that meningitis doesn't quietly repeat, it's just rarely. Some symptoms he had were headaches, vomit, fever, photophobia, and neck inflammation. He was 10 days hospitalized. However, the 3 first days were the most important because the first day he got a head tomography. The second, he got a lumbar puncture, which is known as the spinal test, and it is when a needle is inserted in the space between our 2 lumbar bones or vertebrae. They get a sample of our cerebrospinal fluid, and with that, they test for any infection. They include red and white blood cells, proteins, and sugars, and they also check for clarity and color. The 3rd day, after lots of testing, they were able to find the bacteria that matched with meningitis, and the doctor said that he needed to take a specific antibiotic, and he was able to see a severe change after the antibiotic to the specific type of bacteria. Doctors said that each and every one of us or organisms, we all have multiple bacteria that can activate either to alcoholism, stress, and drugs. This was a fun fact he learned while being in the hospital. And yeah, thank you.